We're rolling. Okay, we have Alexa here, and she's going to demonstrate an adduction with 2 Ds. So we're adding to the middle. So as she engages those muscles, Alexa, thank you. Hold it right there. Now I want you to see the muscles engaged, or they're all going to be in the medial area. So we have the adductor longus, adductor magnus, sartorius is pulling a little bit. And then if you look at her feet, we have a medial rotation, medial meaning towards the midline. Thanks, Alexa. We're going to switch over to Danny here. Danny's going to show us an opposing action. Now, for every prime mover, there is a antagonist. So here we go. We have the abduction. Hold it there, Danny. Ab meaning away from the midline. And this is the muscles engaged are going to be on the lateral side. So tensor fascia latae. You can see the vastus lateralis and the rectus femoris engaged here. Okay, Danny, why don't you bring it to the medial line? And now we're going to watch the quadriceps. There's 4 of them on an extension there. So they're extending the thigh. Thank you, Danny. Good work.
That's a nice preview. So remember some of those actions. Gluteal muscles, you'd be surprised how many gluteal muscles we have, but think about this. This core area is going to control a lot of our movements, a lot of our life-saving actions in the past. The iliaps psoas, which is really 2 muscles, it's a group, it's the psoas major. Look at this, it's originating on the vertebra, part of the thoracic, all of the lumbar, and passing on down into the leg. These are going to flex the thigh and rotate it laterally, the most powerful flexors of the body right here. And that's one of the muscles we stretch that people don't realize when we do some warm-up activities. Gluteals, people often think of the gluteus maximus. Indeed, it's a powerful extensor. Look at the origin. Well, it's on the ilium here. Helps with upright posture, walking. The medius is deep, at least part of it's deep to the maximus. And it can abduct, so it's going to move the femur away from the midline. If you remember, Danny was doing that action. Oh, Alexa too. It's a common site for intramuscular injections right there. Gluteus minimus, similar actions to the medius. So it's going to do some abduction. You don't see it unless the medius has been cut and pulled away. Piriformis, I'll talk about that one. It's close to the sciatic nerve, so when the piriform is injured or inflamed, that's one of the causes of sciatica, pain that radiates down into the leg. The fascia lata doesn't really show up in this upper picture, but it's a sheet of connective tissue, and it's going to be a site of attachment for the tensor fascia lata. And my green arrow is in the wrong place here. Tensor fascia appear. Here's a better example. Far right, nice tensor fascia. We do have something called the IT band syndrome, iliotibial band, and often through repetitive action, but not always. As we age, this tissue is going to dehydrate some and shrink, and so you'll have older individuals that they just get a foam roller, they do everything they can, they stretch. But you can see this tissue is not going to stretch very well. It's a dense connective tissue. The pain often near the femoral condyle, but not always. There's some bursa as well involved. Those are those fluid-filled sacs. Look at all these muscles. You see that if the prime mover, which is the gluteus maximus, fails us, well, we can't just lay down and die. We have these synergist muscles, the piriforms I mentioned, superior gemellus. And superior not because it's better, but it's above the inferior gemellus. That's why we call it that. Obturator internus. That name may look crazy, but to me it makes sense because here's the obturator foramen of the pelvis. So there it is, right? It's originating from the obturator. A color version here, sometimes it helps. Piriformis here, gemellus, quadratus femoris down at the bottom. Adductors, they're going to originate medially, near the pubic symphysis here, and they're going to insert on the femur and tibia here. And look at the names. Brevis, short. Longus is long. That one's often injured. Magnus is huge. Gracilis is a gracile, very small adductor. You can see it down below. It's about the thickness of your thumb. They're all going to have a similar action to adduct the femur and a little bit of medial rotation. If you're not sure what medial rotation is, Alexa, towards the end of her activity, she medially rotated her foot. And so that showed you the action of these muscles right here. Magnus means big, brevis means short, longus, of course, long. Pectineus is sometimes difficult to see on humans, cadavers. Groin pull. I mentioned the adductor longus, but that's not the only one. It tends to be when we're sprinting, twisting, and what happens if we get contusions, the muscle is strained, which means the fibers are torn. We get some bruising, hematomas. Recommendation is price for treatment, protection, rest, ice, compression, and elevation. But after a couple days of this, we want to get blood flowing in there to start healing. So we can't just keep icing it forever. Remember, when you do ice, put some fabric between the ice and your skin, because frostbite does happen when people get too eager with the icing. Okay. Muscles of the anterior compartment. So we're looking at the front of the leg. I like these names. Vastus means big. Rectus means straight. Lateralis means lateral side. Medialis means the medial, midline. So here we have vastus lateralis, rectus femoris, straight, vastus medialis, midline, and underneath, when you pull away the rectus, you have the vastus intermedius, and then the S-shaped sartorius, which is not a quadricep, but it does help with some of the actions. Mostly extension of the knee, but the rectus is going to flex. That means it's going to bring the thigh upwards. Hamstrings, now we're looking at the posterior part of the leg. And before we read all those words, just look at these. Bicep, 2 heads. It's always on the lateral side. So whenever I have a leg in my hand and I'm looking for the bicep, I always find the lateral or outside. First big muscle, bicep. Long head here, short there. Semitendinosus tends to be the next one. And then underneath the tendinosus, deep to the tendinosus, is semimembranosus. Looks kind of like a hot dog in a bun with the semitendinosus. Hot dog, membranosus, the bun. When we get a hamstring strain, there's different grades. If it's just a 1, that just means there's not much of a problem. We get to a grade 3, the person's limping in a lot of pain. Often sprinters, because they have fast starts and stops. Or we have cases where the person's front part of the leg, their anterior quadriceps, is much more developed than the hamstring. And that's typical for lots of people. So that's an imbalance. Contusion, torn muscles, rupture, hematomas. Here's another picture of that semimembranosus, semitendinosus to the lower right. Muscles that move the foot and toes, we have extrinsic, so these are going to originate outside the foot. The anterior compartment, we're going to have the tibialis anterior. It's a large muscle coming down here. And we're going to have the extensor hallucis longus, which is not as large, and that makes sense because it's mostly going to move the toe. Okay, their action is to dorsiflex, so they're going to, as they shorten, they're going to bring the toes upward. Now, we don't stay in this dorsiflexion position forever because we have opposing muscles on the posterior compartment, the back of the leg, gastrocnemius. Gastro is like stomach. These are kind of stomach-shaped muscles, I guess. And they're going to insert on the largest tendon of the body, the calcaneal, used to be called Achilles. And they're going to originate on the condyles, the 2 processes that you can't see here. You can see a little bit in the upper right, a little bit of the, what would that be, the lateral condyle of the femur. Fibularis has the same action as these posterior muscles. It's going to aid in plantar flexion. So when you go up on your toes, that's the posterior compartment muscles. Shin splints. Well, or medial stress syndrome. I've kind of simplified it here because we sometimes have anterior, posterior, and even lateral shin splints. But most of them are due to the tibialis anterior being inflamed, but also due to the separation or inflammation of the periosteum. Okay, so we have the surface of the bone, the very thin membrane of the bone, the periosteum, and that's where the tendons are going to attach. And so let's say you have someone who's running really fast and they're out of shape and they're pounding on pavement as they run. You get a little bit of separation between the periosteum and the muscle tissue and inflammation. Now, if you're not careful and you keep pushing yourself, this tissue is going to scar, it's going to become less elastic, and now we have a permanent situation. So we always want to treat this early. Make sure you do warm up, and in cold weather especially, and don't push it until you're in good shape. The intrinsic, we had extrinsic we just looked at. Now the intrinsic are going to insert and originate within the foot, nothing outside the foot. We have the dorsal, which are not that large. And think about it, because you have the tibialis anterior, you have extrinsic muscles coming over, doing a lot of the work. So we have the extensor hallucis brevis, which there's that word hallucis, think of the toe. It's going to extend the great toe. And the extensor digitorum brevis here, which is going to extend the digits of the feet. Yes. Plantar muscles, now we're going to flip that foot over to the far right. We have the adductor hallucis, so that's going to help abduct, which we don't do much really, but flex, certainly flex. If you ever try to pick up a grape or something with your toe, you're using the abductor hallucis. Flexor digitorum also flexes the toe, and that's a large muscle at the bottom. And the adductor digiti minimi, so it's going to affect the little toe. On top of this is the plantar aponeurosis, which is cut away, but you can see down below, lower right, they're calling it the plantar fascia, which it is, but the technical name is the plantar aponeurosis. And if that becomes inflamed over time, sometimes the bone will respond, the blood's dumping calcium, and we get these osteophytes or bony spurs. Lots of things cause this, and the treatments are variable. Some people put golf balls in the freezer and roll them on their feet and try to cut this inflammation. There's vibration machines and so forth, but it tends to be due to chronic irritation of the fascia, and we don't want it to go so far that we develop bone spurs. Poor fitting shoes. There's a lot of debate about shoes right now, so most experts say go close to the thing you can to being barefoot, but don't run a marathon right off. You got to get used to those barefoot shoes, and once you do, then the foot starts to strengthen. These muscles actually strengthen when we have a barefoot type of shoe. All right, hope you enjoyed it.